Today we're going to do side lying. But before I do that, there was one thing I missed on the face up video, which was the last one, so make sure you look at it, is a good active release on the neck. So what I'm going to do, get some lotion on.
Your hands are so cold.
Why would you tell the camera that?
I'm sorry.
It's also like 30 degrees outside, so. But anyways, making your boss look bad, that's just hurtful. All right, so what we're gonna do is I'm gonna get right in. You wanna find one of those little pockets and kind of press in there, confirm with them, is that a little tender? Yeah, it feels like it's, usually you're looking for a little tight band of muscle. Try to sink in, you'll feel a little like pebble type feel. That's usually the trigger point. So we're gonna, and if it radiates, it's usually a good active trigger point. So
it did. It would fill up my ear.
And her ear. We're just making her hear better. That's what I tell my clients. So we're gonna have you turn your head to the left as I press. Good. And relax. And I'm gonna maneuver a little bit more. Again, go ahead. Is it kind of a good pain? Okay. And then you can do the opposite if you want to get a little bit deeper pressure. I'm going to actually have her push into my hand. Good. Have them do the work, see? And relax. Good. Good, good.
Thank you.
Now she compliments.
Do something nice.
I know. That's my technique. I like to sandwich things. You do something nice, something mean, something nice. All right. The other way as a therapist, if you don't want to hurt your thumbs, I like to get in this position more and then press in. That way I'm leaning in with my shoulder and my hips rather than pushing with my fingers. I can do the same amount of pressure, sometimes even more. All right. Next, we're going to jump into some side lying. Now, Sydney, did you say you had a frozen shoulder, a little bit impingement? Which one?
On the left side.
On the left side. Okay, so these techniques are really great for her. All right, so I'm going to, I think I got you. So I'm going to go over the sheet like that. There we go. Go and just turn on your side. All right, thank you, Caitlin. We're all working together for draping purposes. There we go. This is not a draping class, so I'm not going to go into super big detail. All right. So, some active release techniques. Similar to what we did with the face up. You can come under here. Do it with your fingers if you'd like. See, when they make that face, you know you're there. And have them turn away towards the table. And relax. And the good thing is this doesn't require me to do too much work. You can even put one hand over the other. Use this part of your hand to press into your fingers, and that will help with the pressure so you don't have to hurt yourself. She got a lot going on. She needs a lot of work. And she gets the pleasure of working after this. So.
I'm fine.
All right. One thing we'll go ahead and go over is I'm going to lift her head up into my hand. Caitlin, if you could come see this part over here. I don't know if you can see in your position.
Mm-hmm.
Okay, so some people get a little bit of a hump in here. And what you can do, get your fingers in a hook position. I don't have enough lotion. Don't want to drag too much skin. And what I'm going to do is I'm going to push forward and back. This one's really good for her. Forward. Does that feel pretty good?
It does.
walk your way all the way up. You want to get pretty close to the spine. Just don't press on the spine. So pretty close. Spine's right here. I'm right here. Legs pretty close. And you can do the, you can turn them into it. Just like that. Maneuver their neck around. Next we're going to do is, Sydney, when I tell you to, you're going to turn your head this direction like that. My goal is I'm going to press into that levator scapula.
Okay.
So when you're looking, the levator is going to be right on top of this bone, right here, right there. So we're going to lean in. I'm going to help her turn. Turn. You know you're in the right spot if they feel a stretch. Do you feel it? Good and bad at the same time?
Mm-hmm.
And relax. Again, remember the levator scapula raises the shoulder blade up. So I'm going to have her actually raise her shoulder blade up. That's your arm. There you go. And down. And again, hold the pressure, release. Good. Sydney's actually, her and Zion are the longest running employees I have. 4 years going, almost 5.
Almost 5.
Go Sydney and Zion.
Good, we worked that out. Next we're going to go for a supraspinatus tendon. So the supraspinatus, you're going to, she's already loving it. Great for, this one causes frozen shoulder a lot. If they come up with their arm, they're going to about 16 to 20 degrees. That's where it usually kind of starts hurting, right in here. So we're going to work on some of that. But it starts up through here, runs and through that little triangle and under the humeral joint and into here. So we're going to go ahead and get that. First things first, let's get right on that muscle. Okay, we'll lighten up. All right, so go ahead and raise your arm a little and rotate it. And the other, and down. Again, rotate and down. You're doing amazing. Remember, you don't, with trigger points, when you get on top of them, try not to, I would say, do more of a pumping rather than a holding the pressure for like 30 seconds. She would probably pass out or punch me. Instead, we just kind of hold for like 7 to 10 seconds, release, do it again, just kind of do it like that. If you want, I was doing thumb over thumb or like that with my blade of my palm, which was helping the pressure without hurting my thumb. If you want, you can always get in a forearm. So you don't have to worry about coming up, but just kind of getting in there just like that. All right, next. She's like, why did I sign up for this?
It's necessary.
So next, let's get in. You're looking for, I like to call them hoppers, but that's not an accurate name. But I'm going to keep them. So you'll look for that little hop right there. You feeling that? But too much?
Yeah.
Okay, how about now?
That's better.
Okay, so we're just doing a little bit of pressure. Lean in with your legs. You don't want to, hurt your hands and arms. Can you raise your arm just a tad? That's good. A tad is a form of measurement. And we're down. You're doing great. I like to encourage my people. Again. And down. Good. Definitely needed it, isn't it, Sydney?
That side's jacked up. It doesn't like me.
Well,
It needs
there's
more. It needs more work like
it
that.
needs work, and it also needs to do some strengthening. If you guys look at my mobility and stability training, if you look at the number 10, there's a rowing techniques with the resistance bands. Really good for this.
Need to do that.
All right, next, another way to get to that muscle, Caitlin, you may want to come around, is I'm going to hold their hand like this.
Okay, I don't know where you want me.
All right, keep her on her toes. And then slide. Okay, we're going to back off a little. And then how about now?
It's doable.
Hold for like 7 seconds, release. I'm not holding that long because I don't want to hurt her right now. You know, right before her shift. And there we go. So that's one version of the trigger point, is when you're holding. Another version is when you're doing more of a micro stripping, which basically what that means is if I'm on that tendon, you're going to hold the pressure, try to slide parallel with the muscle, but don't move over the skin. So just kind of a little bit of a movement.
Nice.
It feels nice now that we've done all the means.
Evil.
Good. Next, we're going to do a range of motion technique. It's very good. I'm going to bring her arm up here. One thing to keep in mind if your brain sees something, it's going to know it's safe. So go ahead and look at your hand for me. Hold that. I'm going to come behind, and you're going to hold right around the sacrum. And then, do you see my hand? And come touch it. Breathe. Deep breath. And back. And again. Now lower it a little. Come down. Where are you? Relax. And again. Last time. This is really good for frozen shoulder. And back. Good. What you can also do, you can also get into a little bit of pec minor through here. It's already opened up. Kind of sink right into there and rotate them around. You can do it that way. You can grip. Now Sydney can go practice all these techniques today.
I actually have a few clients who could probably benefit from this, actually.
See, I'm just kind of palpating and pressing in. Try not to do too much deep work, just kind of getting that motion back. All right. Next, I know this is not technically a upper body trigger point, but I like to tend to have her hold here. I'm going to bring her knees up a little. We'll go ahead and get into the QL, a little lower back. And that would be why. So the bone's right here. There's other videos I have if you want to check them out on my channel that shows us better. But Sydney's actually in those too. But the bone's right here. You want to get in and down and try to go under. Okay, she is tender. So we're not gonna really dig into this today. But basically, you go down and sink forward. And then you kind of pull at the same time and give them a little bit of a stretch. Good. And the last move I'm going to do on this face down or sideline series. Don't forget part 3 that we'll do next will be face down and then trigger points with cupping therapy. So Sydney, scoot towards me. Just come a little bit. There you go. So this is a really cool one. So I'm going to bring her top leg towards me. I'm going to kind of hang it off. Yeah, you're in a good position. I'm gonna bring her here. I'm gonna grip right here on that lower back. I'm gonna do a pull and a push. Doing okay?
Uh-huh.
Pull and push. Good. That feel pretty good?
Yeah.
Good. The only downside is we are only doing one side of her body, so she'll be a little lopsided.
Okay.
All right. Hope you guys enjoyed the video. Please hit subscribe, follow us on TikTok and Instagram as well. Please comment below what you think. Have a great day.